we could answer this 1,000. This isn't a game. This isn't a game we're playing. These are our people's lives. I got 4.5 million people in my state, and there's plenty of other people around the country. What we want is good health outcomes for our people, period. I grew up in poverty. I grew up well below the poverty level. I never had any access to health care till I was an active duty Army officer. I was 20-something years old. This is very personal to me. I understand the impact on people. We're not trying to play games to try to save money. We're not trying to play games to minimize numbers or get reelected. This is one of the frustrations that people have with so many people here in Congress, is that it seems too often people's decision-making is predicated on what helps them to get reelected. The American people are fed up with this, frankly. I'm fed up with it as a governor. I'm fed up with it as a taxpayer. I'm fed up with it as a father of 9 children. I'm fed up with it as a part of the recipient of all of this bad decision-making. And so the fact of the matter is this: as governors, we have a responsibility, period, to provide the best possible outcomes for our people that we can. And I don't know a single governor, including those who I disagree with very much as it relates to ideology, on both ends of the political spectrum. I don't know a single governor who isn't trying as best they see fit to do right by their people. There's differences of opinion, of course there are. But at the end of the day, it is our obligation to make sure that we provide the best quality. Final thing I'll say is this. Think about this. What is the point of this? This argument that people having coverage is the solution? Nonsense. Nonsense. Coverage is of no value if the coverage does not allow you to get access, and you can't then afford the access that you may or may not have. The whole point of all of this is to get better health outcomes. Sadly, we represent 2 states that don't lead the nation in ways that we would like as it relates to health statistics. We're at the other end of the spectrum. And that's not something either of us are proud of, and nothing that we're not trying to address. But I will say this. At the end of the day, it's imperative that we get better health outcomes, period. And so we are going to do anything we can, including creating a sense of competition and bringing a sense of energy into this by giving control, because as was noted 200 and some odd years ago, states, we're the laboratories of democracy. We're the innovators, and we can steal from one another ideas and best practices, and that's really what needs to happen. You want best ideas to come forward? Let the states be these little incubators of these things. And I will tell you, it's not to assume that what I do is going to be what he does or vice versa or anyone else. But at the end of the day, I want for the people who are in the same boat that I was in for the first half of my life, I want them to have the on-ramps to the American dream. And part of that is to have access to quality health care and the possibility of being healthy as they grow up. And that's no different for me than any other governor I know.